Each day, we come across countless television and radio programs, news articles, and personal experiences surrounding death and dying. As an individual, we have all different relationships with death, shaped by our personal experiences, religious beliefs, spiritual views, culture, family history, and current life circumstances. Regardless of the relationship, we all have one connection. Death is a significant part of our lives, and we will all experience it. Hello, and welcome to our educational podcast on the topic of medical assistance in dying, also known as MAID. My name is Stevie, and presenting alongside me are Courtney, Joyce, Chrissy, and Bailey. We will take you on a journey to discover the history of dying and MAID, beliefs, views, and assumptions, nursing issues, and the role of the nurse. We will also talk about stakeholders, ethical and legal elements, barriers, and strategies for lobbying. As a society, we are in the midst of a significant change. The arrival of medical assistance in dying shines a light on how Canadians are talking about death and dying and the choices available at the end of life. Historically, it has been a crime to assist another person regarding their condition, concern, or circumstance to end his or her life. However, a medically competent dying person has a right to refuse treatment, which includes cessation of eating and drinking. Furthermore, attempting to commit suicide was decriminalized in 1972. In 2016, the Supreme Court of Canada determined that denying assistance in dying for a competent adult who is suffering intolerably from a grievous and permanent medical condition and to seek medical assistance in dying violates a right under the Canadian Charter of Rights and Freedom. In June 2016, the Government of Canada passed Bill C-14 that legalized MAID. Traditionally, care for the dying person was the domain of religious and charity organizations. The creation of palliative care was based on the principles of upholding life and living actively as long as possible. In this approach, death is regarded as natural. However, one ethical concern about palliative care is the inability for people to access it. According to the seminal Senate report, Raising the Bar, a roadmap for future of palliative care in Canada, only 16 to 30% of people have some level of access to palliative care resources. For this reason, many nurses assume that the people who are unable to access care will opt for MAID to end their discomfort. Similar to palliative care, end-of-life care provides people who are terminally ill with care. However, this type of care is considered broader and can also help support family members. Types of care can include respite and home care. The introduction of MAID has dramatically shifted the landscape of options for people who are experiencing irreversible diseases. While palliative care and end-of-life care are often used interchangeably, with the goal to focus on quality of life and reducing pain and suffering until natural death occurs, MAID is intended to facilitate a foreseeable death. Because MAID causes death, it violates deeply held religious beliefs or philosophical views of many Canadians. The vision of MAID can be deeply upsetting, especially to the family members and friends of the person requesting MAID. One reason may be because their fear of their family member might be judged for the act and have a different afterlife as a result. Despite resistance from some organizations and individuals, it appears that 79% of Canadians have come to accept MAID as a fact of life and death. As we move along to nursing issues and the role of the nurse, listeners, please take a moment and reflect on your own personal views. Are you a part of the 79% of individuals who accept MAID, or do you reject the idea?
Hello, I'm Courtney, and I'll be going over nursing issues and nursing roles. The three main reasons in the text Realities of Canadian Nursing that make the issue a nursing issue are: it raises ethical controversies, and some may feel morally obligated to deny participation. It is a new trajectory that not only impacts nurses professionally, but bears emotional distress, and that there are many legal and regulatory implications for nurses. According to the article titled Medical Assistance in Dying, the principles of respect for autonomy, non-maleficence, beneficence, and justice have been used to support and challenge MAID as a part of the nursing care and as a legal service. Nurses face a challenge to deal with practice, professional, and personal ethics when faced with MAID. Legally, nurses can assist with the process of MAID. However, when ethics comes into play, involvement may be questioned on an individual level. MAID becomes a nursing issue because nurses may look after patients who request MAID. The passing of the process warrants a change for nurses who have been educated and trained towards supporting life. Bufane and Bruce acknowledge that this certain trajectory of death is new and that this form of death is anticipated, hastened, and quick. The criminal code offers support to those who object to participate in MAID. However, in contrast to that, RNs have a legal duty to care for their patients, so by not fulfilling their duty, they are at legal risk. Listeners, do you think you have been informed enough about MAID, and do you know ethical or legal obligations regarding the same? Nurses are directly involved with patients who request or are contemplating MAID. Nurses can objectify to the process and not be involved in the process, but this does not completely warrant dismissal of the nurse's professional obligation to care for the patient. Nurses have a professional obligation to provide care at the end of life and to help facilitate access to end-of-life care options such as MAID, despite their view on it. According to the Canadian Nurses Association, nurses give perspective and contribute to the act of MAID. However, it should be noted that the Canadian Nurses Association also states that nurses are not permitted to determine the eligibility, but should discuss a request for MAID with appropriate members of the team. It is also important to document the conversation regarding MAID. Nurses should check with their agency policy as well as SRNA policy regarding MAID and fully understand their roles and responsibilities prior to putting themselves into a situation where MAID is to occur. Listeners, if a doctor asked you to perform a task regarding MAID, do you feel comfortable refusing due to agency policy? The CNA is also very clear in that nurses must never recommend or encourage MAID. Registered nurses must never administer the medication, but they can insert the IV that may be used for the process. As a nurse, you can provide nursing care up to the process, be present when the process is occurring, provide holistic nursing interventions to the family and patient during the process, as well as afterlife care. As nurses, it is detrimental to be knowledgeable and ethically prepared to assist with navigation for those families who choose the MAID route for end-of-life care. As a future RN, how would you advocate for a patient seeking MAID when or if your institution directly opposes the MAID service?
Hi, my name is Joyce. I will be talking about the three key stakeholders that are directly involved in the issue of MAID. First are the regulatory bodies of nurses in each province and territories. According to the Canadian Nurses Association, regulatory bodies have the legal mandate to protect the public by ensuring that nurses who assist in the practice of MAID are qualified and provide safe, competent, and ethical care. In addition, they are also responsible for setting professional standards and guidelines under the scope of practice established for nurses. It is important for nurses to consult their regulatory bodies for guidance, competencies, and policies in relation to provision of MAID. Another primary stakeholders are the physicians, as MAID allows physicians to administer or prescribe medication as an option for end-of-life care. Physicians must ensure that patients who request to receive MAID are eligible based on the listed criteria. Also, physicians who are unwilling to provide MAID should be prepared to provide referral to practicing physicians for patients who wish to have medical assistance in dying as an option. The last key stakeholders is the Government of Canada in all levels. After the federal legislation passed in June 2016, all levels of government have the responsibility for determining how and where healthcare services are provided. Also, they are responsible to make policies around medical assistance as long as it does not create conflict with criminal code. Minister of Health Jeanette Petpas-Taylor stated that medical assistance in dying is a sensitive, complex issue and many Canadians have deeply held views on the subject. The Government of Canada are committed to ensuring that Canadians who choose medical assistance in dying have access to these services. Now that we know about the roles of these primary stakeholders, how does the government, regulatory bodies, and physicians collaborate to ensure that comprehensive standards, guidelines, protocols are developed to ensure healthcare providers and patients who wish to have MAID as an end-of-life option? Personal communication by the head pastor of Esther Hazy Full Gospel Church, Brent Nightingale, stated, as a Christian, they strongly believe that healthcare providers or any person should not assist death. It is not our place to step in and make someone die. At the same time, we need to do everything we can to make people as comfortable as possible when they are experiencing a terminal illness. Keeping someone alive indefinitely through measures like feeding tube or breathing machine when there is no brain activity as unnatural. Let the person go naturally. This statement raises the issue that religion and spiritual beliefs play a central role in end-of-life decision-making of many patients and healthcare providers. We need a deeper understanding on the ethical and legal stances on the issue of MAID.
My name is Chrissy, and I'll be discussing an ethical and legal analysis. To understand the ethical and legal stances, it is important to note there is a shift from Christian-based views to humanistic-based views within the current healthcare system. This shift is evident in Canada through the new legal aspects such as the repeal of the law against suicide in 1972 and the passing of Bill C-14 legalizing MAID in 2016. The passing of Bill C-14 means that it is no longer a criminal offense to participate in MAID. From the legal perspective of regulatory bodies such as the CNA and CRNA, the nurses have a duty to care at all times. However, this does not mean they are obligated to assist in MAID. This means that whether the nurse agrees with the procedure or not, they cannot abandon their patient. If there is another nurse who can care for the patient, then care can be transferred, but care can never be abandoned. This takes the conversation into the ethics of MAID. Ethics itself is a form of philosophy. MacDonald and McIntyre quotes Storch's definition as a generic term for various ways of understanding and examining the moral life. Ethics looks at the moral dimensions of nursing and the normalized views and beliefs in nursing. An important question that MacDonald and McIntyre asks in regards to ethics is what is right within a moral code that is highly influenced by Christianity in our Canadian context. This really shows how the values of our society were strongly influenced by Christian beliefs in the past. With these new legislations, there is evidence of a shift. MacDonald and McIntyre also discuss that increased time, knowledge, experience, and support are shifting beliefs and views to be more supportive of MAID. Ethics and society are very closely connected, so as society's values change, our definition of ethical care will change as well. Nursing is rooted in ethical behavior. We see this through the important and crucial role the CNA Code of Ethics plays in every clinical setting. It is one of the key competencies in nursing. MAID allows for a person to choose their own time of death, and this can challenge existing ethical beliefs. Around the subject, there tends to be heightened emotions, sensitivities, awareness, and new ethical concerns. Ethical concerns include 1. Other options for end-of-life care being provided in an accessible way, and 2. The reasoning behind choosing MAID as an option, such as is the patient choosing to prevent a painful death or to prevent themselves from becoming a burden on family and healthcare providers. Another part to the ethical controversy of MAID is that an individual has the right to conscientious objection. However, there are whole institutions that are also refusing to provide these services due to conscientious objection. MacDonald and McIntyre discuss the viewpoint that a publicly funded institution has no right to deny a patient care, with 2 questions to help with the analysis. Firstly, is it ethical for a patient to have to be transferred to a different institution for care? Consider the emotional and possibly physical impact on the patient and family. Secondly, is it ethical for religious-based institutions to go against their deeply held values of their faith? Once again, these 2 questions come down to where our ethics are being rooted, a humanistic perspective or a religious viewpoint. We also need to consider that if we as nurses are to perform safe, patient-centered care, then should the beliefs of the patient come before our own beliefs? Or is it more important for the beliefs of the institution to influence the patient? So, listeners, let me know if you agree or disagree with this analysis. The analysis of ethics connects deeply to where our values are rooted and the belief systems that are used. The MAID values-based self-assessment tool for healthcare providers provides 7 key values to be assessed. These values are specified as key to gaining a full understanding of the ethics around MAID. These values include autonomy, choice, patient-centeredness, suffering, quality of life, dignity, sanctity of life, secrecy, and stigma. So listeners, what are your understanding of these values? Let's have a great discussion in the forums as we go on to the barriers and strategies for MAID.
Hello, my name is Bailey and I'll be exploring the barriers surrounding MAID and the possible lobbying strategies for resolution. Nurses can utilize different strategies when solving health issues in their communities. However, according to McIntyre and McDonald 2019, when a nurse identifies specific barriers to resolution, possible interventions through mediation, collaboration, and negotiation can exist. With understanding the barriers, this increases the success rate of overcoming obstacles and supporting their population of focus. In Canada, the stigmatization, insufficient resources, and lack of specialists pose significant barriers to health. The ongoing stigma surrounding MAID is detrimental to health. One common misconception in Canadian society is that MAID is an alternative measure to palliative care services. According to Ball and Anderson 2017, though palliative care might be the right and ethical experience for most individuals, there are others with unbearable suffering that could only benefit from utilizing MAID services. An individual seeking MAID services may have additional stress caused by stigmatization. Family and friends may not understand the reasons behind accessing MAID, and this will put a strain on their loved ones' relationships. Nurses must be aware of stigmatization and its effects on our clients' health and advocate for a supportive, healing environment. When researching insufficient resources, it was found that Canadians living in rural or remote communities face challenges in accessing end-of-life care services. Traveling great distances is impractical and takes a physical, emotional, and financial toll on our patients and their families. According to Collins and Lear 2017, dying patients are often too weak to travel and less ideally to leave their supportive home environment. Telehealth could be an option to fill this gap, but the actual administration of the drug is a barrier. Patients often feel that having a health practitioner in the room offers support and increases the therapeutic experience this patient will encounter as they pass on. When looking at the lack of existing MAID specialists in the healthcare community, this limits the distribution of appropriate training, standards of practice, and competency. With the lack of specialists in this area, patients can experience distress when trying to access this vital service. According to Kashnood 2018, there is no current standard approach for educating physicians and trainees on the provision of MAID. With the lack of education in this area, patients are unable to utilize MAID as an end-of-life option. In order to adequately address the topic of MAID in Canada, McIntyre and McDonald 2019 state nurses may use lobbying to influence key stakeholders directly or indirectly, as well as educate themselves on the concern by providing clear, concise evidence proving the importance of the issue in order to increase the success of their influence. Social media, letters to the government, and briefing notes all can be utilized to effectively bring about change. Going forward, I'll explain these strategies in detail and how they can impact the discussion of MAID. According to McNabb 2009, with the increased access to information and communication, social media is radically changing the way we communicate with one another. Nurses can use a variety of social media platforms to communicate with communities around the world and rally support for their cause. According to Stats Canada 2017, 76% of Canadians owned and used a smartphone daily. With the power of technology has in today's society, nurses can utilize this outlet to showcase the inequalities individuals accessing MAID may face. Nurses may also use educational anti-stigma campaigns through social media, allowing for modern and timely lobbying strategy. This can promote awareness of MAID and help tackle the stigmatization in today's society. According to McIntyre and McDonald 2019, letter writing is one of the most well-used lobbying strategies. Nurses can utilize letters to government officials by highlighting the need for equal accessibility amongst Canadians for palliative care and MAID services, as well as addressing social determinants of health preventing MAID availability in rural and remote communities. By contacting the government officials, nurses can help speak on behalf of our patients by highlighting the health inequalities they may face. Through proper lobbying, social change can occur and our patients' health will benefit. Lastly, a briefing note can be used by nurses as a lobbying strategy. According to McIntyre and McDonald 2019, a briefing note is a short paper communicating issues, backgrounds, current context, barriers, and potential strategies for resolution. Sending a briefing note to the nursing regulatory bodies outlining the need for enhanced training, opportunities, and information sessions for nurses choosing to participate in MAID is one step towards a resolution of this issue. Through this week's discussion, we look forward to hearing new, unique lobbying strategies that a nurse could use to effectively promote change for patients seeking MAID services. I also would like you to reflect on how government officials' beliefs surrounding MAID may be a barrier to you influencing change.
Thank you for listening to our podcast on the topic of MAID, or medical assistance in dying. Throughout our podcast, we touched upon the history of dying, religious beliefs, and philosophical views and assumptions surrounding MAID. We looked at nursing issues such as legal obligations and the role of the nurse. We acknowledge that there are three main stakeholders that are directly involved in MAID. These include nursing regulatory bodies, physicians, and all levels of government. We also recognize that the ethical controversy around MAID is complex and tends to be centered around personal belief systems and their impact on healthcare as a whole. With all controversial topics, barriers do exist, and we need to focus on lobbying strategies by using social media, letters to the government, and briefing letters. We hope this podcast allows you to leave with open eyes and a new perspective on death and dying. For more information, you can visit the Canadian Association of Nurses, Saskatchewan Registered Nursing Association, or eHealth Saskatchewan to support you as a nursing student. We look forward to hearing your thoughts and feedback regarding MAID.